Hi, today we're joined by Rachel Taylor, who is the Patient and Public Involvement Lead at the NIHR Oxford Biomedical Research Centre in the UK, but is also one of our advisory board members of the Step Change project. So thank you very much for joining us today, Rachel.
Nice to be here. Thanks for inviting me.
So could you just describe your role in a little bit more detail and the work you do at Oxford BRC, and as well as kind of with patient and public involvement at Oxford, please?
Sure. So I work in, as you said, patient and public involvement in research, which is abbreviated to PPI usually. And that just means really getting patients and the public involved with research, not as participants on trials, but in terms of designing and informing research and making sure that it's most appropriate and most relevant to those who are going to benefit from it. So we run various PPI groups and researchers can come along to those groups and ask people how to make their research more inclusive, etc.
So there's quite a bit of co-designing between the research groups and the citizen/patient groups, perhaps.
Yeah, yes, definitely. Researchers and PPI contributors, as we call them, work quite closely together to make sure that research is as applicable and relevant as possible.
And I suppose in these times when, especially, it's not just COVID, but it's hard to not say COVID in these conversations nowadays, but as kind of public attitudes towards science, especially the biomedical sciences, have been increasingly shifted. How important is kind of these PPI groups when it comes to conducting research in the modern new normal that we find ourselves in? And has this change in perception affected the way you communicate about citizen science or the research you do, I suppose?
Yeah, I think it's changed. I mean, it's had the advantage in this, got a lot more people interested in the science. You know, we sort of were all exposed to the sense of the stages, in a way, of the vaccine being developed, the need for participants to develop that vaccine, those vaccines, and the urgency and the kind of the benefits were sort of laid out to us in a very stark way, I think. So I think a lot of people got interested that perhaps weren't interested before, but it, as you say, it did highlight the need to communicate science in a very effective way, because if we want people to be involved and to also benefit from the outcomes associated with science, we need to be clear about what those benefits are, and sort of make sure that people aren't too concerned about any risks. So, and I think COVID has definitely had a dramatic impact on those sort of things. I think there's a much more sort of, I suppose I could only say, kind of constant conversation about making sure that the findings of science are communicated really well. And when it comes to PPI, also just making sure that everybody has the opportunity to be involved. So with COVID, we realized how much worse outcomes there were for people from some minority ethnic communities. And that led us to also realize that we needed to involve more people from those communities in the design and the implementation of research. I mean, one stark example was the oximeter that measured oxygen levels, which didn't work so well on people from ethnic minorities because it hadn't been tested on people from those minorities. So I think there were quite a lot of examples that really showed how important it is. So I think, you know, there was a lot about COVID that really highlighted the importance of being very inclusive, and making sure that as many people from different communities are involved in research, but along with that goes making sure that we communicate research very well, both the benefits and also how to get involved.
And yeah, just to reiterate your point, it was just, the idea that everyone had kind of front and center seats to kind of one of the most important biomedical kind of research projects in many of our lifetimes, I suppose. And just sort of, if you might have asked someone from the general public what a PCR test would have been 3 years ago, they may not have really had a clue what it is, but now everyone is more literate in this sort of terminology, which there's definitely kind of a for better and for worse kind of aspect of that, especially with the amount of information that's out there at times. And I suppose sort of the work that you do, including groups that may or may not have so much kind of interaction with bioscience research, and just including them to kind of garner that trust a little bit, I suppose.
Yeah, no, trust is so important, because obviously that was a big issue that came across as well during COVID, you know, people not necessarily feeling that the vaccinations or the treatments were safe and hadn't been safely tested on enough people or enough diverse people. So yeah, no, it's very important.
So when it comes to the work you do with PPI, could you describe some of the challenges of including these patient and citizen groups within medical research?
So the main challenges would be, I think we've talked about researchers being able to communicate their research in a way that makes it meaningful for people. So if it's all very much about the process of how the research is done, that's going to be less interesting for people generally than this is the benefit that potentially cancer patients or COVID patients or whoever it might be will get through this research. So I think one of the big challenges is supporting researchers really to be able to communicate well. So one thing we do when researchers come along to our meetings, we ask them to send us their slides and their presentation in advance, and then we send it out to PPI contributors to look at it before the meeting to see that it's actually in lay language and people are going to understand it. So yeah, communication is a challenge. I mean, there's other challenges as well. People have busy lives. So trying to find a time when people can meet that's convenient to everybody. So one thing we did there was we surveyed people and asked them would they prefer evening or lunchtime. And we sort of had 50-50. So we alternate each month. Sometimes one time we have an evening meeting, one time we have a lunch meeting. Another key thing which touches very much on the first thing I said is researchers actually letting us know what difference the input has made. So researchers tend to be quite good at coming for thoughts and ideas from PPI contributors, but they're less good at coming back to the PPI contributors and saying, this is the difference that it made, and this is what I did as a result of what you told me. And that's very important because it makes it, you know, makes PPI contributors feel they're doing something useful. It also makes them realize where perhaps their contribution hasn't been able to be implemented, but they understand why. And it motivates them, keeps them do it, you know, and it's good to have, you know, we've got some people who, it's good to have new people, but some people stay for a long time and they get quite skilled at this work.
Oh, that's really interesting. And yeah, the idea of contributors feeling that they're actually being listened to and their thoughts and inputs have actually been used to craft this experimental design more than just sort of like slight lip service to reaching out and involving people, I suppose.
Yeah.
And
exactly.
I suppose part of that is the importance of having participation, having inputs from the citizen groups and patient groups throughout the process, I suppose. So in the experimental design, within the data collection, within the data analysis, and then the action plan that might result from that, I suppose. Yeah, could you talk a little bit about how you integrate these groups into various stages of the project work that you do?
Yeah, no, again, absolutely fundamental that people are involved at every stage. I mean, very often PPI sort of starts when the grant application is going in, because to put it bluntly, it's needed at that stage to get funding. But obviously not necessarily prior to that, to sort of think about what are the priorities for people in terms of research. And that's not something I've personally had much involvement with, although I am currently working on a project, an Oxford University project called Science Together, which brings together community groups and researchers. And I'm working as one of the facilitators on that to bring those two groups together. But the research is very much driven by the needs and the priorities of the community group. So this is called, the group that we're working with is called Oxford Community Action, and it's a Black, Asian, Caribbean and ethnic minority community group. And that's, they're looking at certain things, like, for example, they wanted to find out more about new treatments to do with sickle cell disease, for example. So then we're linking them up with relevant researchers and they're working together. So that sort of priority setting, it does happen, but it's a very involved process to do priority setting, and it takes quite a long time, and it takes a lot of money. So that doesn't happen quite so often, but certainly in grant applications, PPI does happen, and that's a good thing, and PPI contributors can make a difference to that application, particularly having the eyes of the sort of lay panel member who will be looking at that application. So that's very important. Yeah, and then further down the line, of course, when you're doing things like designing participation sheets to get people involved, now that is really vital to have PPI contributors, and they can be very helpful there. With the analysis, that's less often something that happens, but it does happen. And you know, certainly with qualitative thematic analysis, if you've got researchers doing that, looking at themes, it can be very helpful to have PPI contributors' perspective on that as well. And then, of course, dissemination is particularly important. So links with PPI contributors might well have links with community groups, links with different just communities and they can help in thinking about how best to disseminate this research so that it is used.
No, that's really interesting. And yeah, it just goes to show, yeah, the participation within research doesn't need to, as I'm relatively new to the citizen science project, from the projects I've worked on in the past, a lot of it has been environmental stuff, grunt work, just sort of going out and collecting data. But it's nice to see how citizen science and PPI has kind of been adapting over these last few years to be more inclusive throughout the whole process, I suppose. So I said at the beginning of the interview that you, as well as the work you do as a patient and public involvement lead, you've also are part of the Step Change Advisory Board, and you've been working quite close with our partners at Oxford BRC with their non-alcohol fatty liver disease. I'm just wondering if you could describe a little bit your role as an advisor, and what has that entailed a little bit?
Yeah, my main role has really been to help make sure the materials for recruiting citizen scientists onto this project are really kind of accessible and easy for people to understand what they're being asked to do. So I helped the lead Sawa on that, and Sawa's our lead in Oxford. And then the other thing that I've done is I've gone out to people that I work with, PPI contributors that I work with, and asked them if they want to be involved. And we've had quite a few people involved from different backgrounds, you know, who've stepped up and said that they will support this work. So, and one of them actually was Citizen Scientist of the Month, I think. She's really enjoying it. So yeah, no, that's been my main role to date.
So this is a little bit of a question about, it kind of links a little bit to the work you did with recruitment, I suppose, within this citizen science initiative. Part of the criteria for people to citizen scientists to get involved, or part of this PPI kind of procedure, was having some previous experience of working with liver disease or obesity or weight loss, which I imagine is quite important for some aspects of the work that is being done within this CSI, especially for maybe experimental design or in that aspect. But for research projects like this, is it always a criteria to have previous experience, or is there place in the world for lay audiences to get involved with projects like this, do you think?
Definitely. I think it's really about, it depends upon the project. And in some ways, it's often quite good to have a mix. So people with lived experience obviously do bring that very personal experience of having that condition, and they're going to know stuff that people that haven't had that condition just will not know. So that is really important. On the other hand, other people may bring different skills. So patient and public involvement is called both patient and public, because public, the patient is when you've been treated, as it were, for a particular condition, and you're supporting research to do with that condition. But public is more to do with bringing an outside perspective, so you can still bring that perspective and some of the skills are very generic. For example, how researchers make language accessible and that sort of thing. But also public members as well as patients may have particular skills. They may be able to analyze material. We had somebody who helped us, who led the co-production of our strategy, for example, and she'd worked in business and she'd written numerous strategies in her life, and she knew how to involve all the different stakeholders. So she wasn't acting as a patient member, she was acting as a public member, but she brought a huge wealth of experience and knowledge and perspective to that. So I think it's good to have a mixture, but there's certainly some research where it's only going to be, you're only going to want to have people that are patients. You know,
Sure.
it depends it really depends what it is.
I suppose that links a little bit back to kind of like the knowledge of crowds and having kind of inputs from everyone a little bit, but also getting out of your own bubble and making kind of like links within society and communities that may not have experienced any of these sort of the ill effects of fatty liver disease, or just sort of increasing public awareness, I suppose.
Right, exactly.
How do you think that we could broaden citizen engagement and participation in the future within research projects such as the ones you do at Oxford BRC? And what additional infrastructure do you think may need to be put in place for more effective research like this?
I think the key thing is it's what we give back. So I think we're quite good at asking people to do things for us, and people, the public and patients, can be very willing because they want to help and they want to make science better. They want to make it more relevant to people. But I think sometimes we can be a bit less good at showing what we provide, and what is there training that we can provide, what skills will you get out of this. So I think that's probably the most important thing that we really need to think about, and asking people, because it's not the same for everybody. People have different motivations for doing this type of work. For some people, it really is imparting their expertise because they've already got a lot of experience in this area, perhaps. Others, it may be very much a heartfelt feeling of, I know someone with this condition, or I have this condition, just really want to make sure that any research and treatments benefit people. Other people want to really use their skills, or they may want to learn new skills. So I think it's just a case of thinking about, what do people want out of it, and being prepared to be quite flexible and personalized in the approach of what you can offer to keep people motivated.
I think that's a great response, because throughout this conversation, I've been thinking about just sort of like the flexibility that's needed within recruitment, within keeping citizen scientists or participants sort of on board throughout the project, because obviously people's lives change and people's sort of free time or commitments change as well. So yeah, just that aspect of needing to be flexible and not too rigid seems like a very important point.
Yeah.
No, this was a great conversation. Thank you very much for joining us today, Rachel.
You're very welcome, Chris.